And what we're really striving to do is help the pain advocates set up a place to capture the voice of the patient. And we were sort of working oddly on a different topic initially. I have an interest in setting up this network so we could sort of rapidly get the patient voice on important issues. And I had just come from a big meeting in Washington, and I felt like the people who were long-term opioid responders were extremely poorly characterized and left out of the meeting. So we were going to set out to do a survey of those people, and that's still in the plans. But then we realized when we just how quickly we could get information from like thousands of patients, people with chronic pain. And so we were coming right up on 100 days since the rescheduling of hydrocodone. And we said, this is just absolutely the best way to do something like this. It's timely. There's a major meeting coming up. We got to get this information out there. And, you know, so we put it out on SurveyMonkey through some patient advocacy groups, and, you know, and we cut it off artificially at 17 days to make the deadline for the meeting. But the plan was to have it be up for a month. In any case, 5,000 some odd patients responded immediately. So the survey was just a SurveyMonkey thing, sort of face valid kinds of questions, trying to capture what people's experiences have been like in terms of cost, the expense to them out of pocket, in terms of what it did to them clinically, what it did to them in the doctor-patient and pharmacy-patient relationship, and all of that. And I mean, what's on that poster is we had to cherry pick it a little bit because, I mean, you know, it's sort of 64 somewhat disparate questions, and when we write the paper on the entirety of it, there's going to be a ton of data. But, I mean, I'll sum it up in sort of, you know, one sentence. Since the rescheduling, legitimate people who legitimately need hydrocodone for chronic pain have been inconvenienced, have noticed friction in the doctor-patient relationship about getting their medicine refilled, have had problems at the pharmacy in getting their medicine from having to go to multiple pharmacies and whatever, and delays in obtaining their medicine causing withdrawal.